Welcome to Beyond the Stethoscope, where we explain what's really happening behind the scenes in healthcare in a way that actually makes sense. Today, we're talking about Ebola, and just hearing that word can make people nervous. Ebola sounds terrifying because, honestly, it can be. It is a serious viral illness. It can spread in outbreaks, it can kill people. And when you see headlines about Ebola, especially when they mention deaths, travel screening, or outbreaks in other countries, it is completely reasonable to wonder, should I be worried? The honest answer is this: Ebola is serious, but for most people in the United States, the risk remains very low. No, that does not mean we ignore it. It means we understand it. So let's walk through what Ebola is, how it spreads, what symptoms look like, what treatment exists, and what actually raises your risk. Ebola is caused by a group of viruses called ortho-Ebola viruses. These viruses are mostly found in parts of sub-Saharan Africa. Ebola disease is rare, but when outbreaks happen, they require a very aggressive public health response. The CDC notes that symptoms can appear anywhere from 2 to 21 days after exposure, most often around 8 to 10 days. Early symptoms can look like many other infections: fever, body aches, fatigue, headache, sore throat. Later, people may develop vomiting, diarrhea, stomach pain, weakness, and in some cases bleeding, and that is one reason Ebola is difficult early on. At first, it may not look like Ebola. It may look like malaria, or flu, or a stomach virus, or another common infection. But Ebola is not spread the way flu or COVID spreads, and that is one of the most important things to understand. Ebola does not typically spread through casual contact. You do not usually get Ebola by walking past someone, sitting in the same room, or breathing the same air in a normal public setting. Ebola spreads through direct contact with the body fluids of someone who is sick or has died from the disease. This can include blood, vomit, diarrhea, saliva, sweat, urine, breast milk, semen, or other bodily fluids. It can also spread through contaminated needles, medical equipment, bedding, clothing, or contact during unsafe burial practices. That last part matters. In many Ebola outbreaks, some of the highest risk situations involve caregiving, healthcare exposure, and funerals where family members touch or wash the body of someone who died from Ebola. The virus level can be very high late in illness and after death. So when public health officials respond to Ebola, they are not just treating patients, they are tracing contacts. They are monitoring exposed people for 21 days, isolating patients safely. They are protecting healthcare workers and helping communities perform safe burials. And they are trying to build trust because fear and mistrust can make outbreaks worse. Right now, as of late May 2026, the CDC reports an Ebola outbreak in remote areas of the Democratic Republic of the Congo and Uganda. Importantly, the CDC also states that no cases have been confirmed in the United States from this outbreak and that the overall risk to the American public and travelers remains low. That is the balance. The outbreak is serious where it is occurring, but that does not mean the average person here is in danger. The current outbreak involves Bundibugyo virus disease, which is one type of Ebola disease. The World Health Organization, or WHO, has reported that unlike the Ebola Zaire strain, there is no licensed vaccine or specific approved treatment for Bundibugyo virus disease, though early supportive care can be life-saving. Past Bundibugyo outbreaks have had case fatality rates in the 30% to 50% range. That sounds frightening, and it is serious. But again, risk is not just about how dangerous a disease can be. Risk is also about how likely you are to be exposed. So for someone living in the United States with no recent travel to an affected area, no contact with a known Ebola patient, and no occupational exposure, the risk is extremely low. While a healthcare worker caring for Ebola patients in an outbreak zone, the risk is much higher. For a family member directly caring for someone sick with Ebola, the risk is higher. For someone participating in unsafe burial practices involving a person who died from Ebola, the risk is higher. That's the difference between danger and personal risk. A shark is dangerous, but if you are sitting in your living room, your personal shark risk is low. Same concept here. Now, what should someone actually do? First, do not panic over headlines. Second, pay attention to travel history. If someone has recently been in an affected region and develops fever, vomiting, diarrhea, severe weakness, or unexplained bleeding within 21 days, that is not something to ignore. They should contact public health authorities or a healthcare facility before simply walking into a crowded clinic or ER so precautions can be put in place. The CDC advises travelers leaving affected areas to monitor for symptoms for 21 days and avoid travel if symptoms develop. Third, understand that Ebola is not contagious before symptoms begin in the same way we think about many respiratory viruses. People are most concerning when they are actually ill, especially when they have vomiting, diarrhea, bleeding, or severe weakness. Fourth, good infection control works: gloves, gowns, eye protection, masks when appropriate, safe handling of blood and body fluids, careful cleaning, safe needles, isolation, contact tracing. While this is not glamorous, it is what controls outbreaks. Now let's talk about treatment. There are approved treatments and a vaccine for some Ebola virus species, especially Ebola Zaire, but this current outbreak involves Bundibugyo virus disease, and WHO states there is no licensed vaccine or specific therapeutic approved for that strain. Still, supportive care matters. That means fluids, electrolytes, blood pressure support, oxygen when needed, treatment of other infections, and careful management of complications. In plain English, even when there is no perfect antiviral cure, good medical care can still save lives. Ebola can cause severe dehydration from vomiting and diarrhea. It can affect blood pressure, it can injure organs, it can lead to shock. So, early recognition and supportive treatment are critical. But containment also depends on something that does not always make the headlines: trust. People have to trust the healthcare workers. They have to believe the disease is real. They have to understand why isolation matters. They have to be willing to report symptoms. They have to be willing to accept safer burial practices. When communities are afraid, angry, or misinformed, people may hide illness, avoid care, or attack treatment centers. That makes the outbreak harder to control and puts everyone at greater risk. So, should we be worried? Here's the calm, honest answer. We should be aware. We should be respectful of how serious Ebola is. We should support strong public health response in affected regions. We should take travel related symptoms seriously. But most people watching or listening to this should not be walking around afraid they are going to catch Ebola at the grocery store, airport, or doctor's office. That is not how Ebola usually spreads. The people at greatest risk are those with direct exposure to a sick Ebola patient. Body fluids, contaminated materials, unsafe burial practices, or healthcare work in an outbreak setting. For everyone else, the risk remains low, and that is the key message. Ebola deserves attention. It does not deserve panic. When scary diseases make the news, the best thing we can do is slow down, ask better questions, and separate what is possible from what is likely, because those are not the same thing. I'm Arn Facklam, nurse practitioner and fellow of hospital medicine. This is Beyond the Stethoscope, helping you understand what's happening behind the scenes in healthcare without the fear and without the jargon. Hey, quick pause. If this is the kind of thing you wish someone had explained before the headlines got scary, follow the show wherever you're listening, on Apple or Spotify. And on YouTube, go to the Plain Speak channel to find us and hit like and subscribe. It takes 2 seconds and it helps more people find calm, clear healthcare information when they need it most.